Good afternoon. It is time once again for Evergreen Talks, a monthly Facebook Live event where our physicians and providers and specialists at Evergreen will present topics that matter to you. And today we go to Evergreen Women's Health and find Dr. Liz Oler. Hi, Liz.
Hey, Brian.
Today we are going to talk about, well, Dr. Oler is going to talk about birth control. And I'm glad that it is your presentation and not mine because you are the expert and I am not.
That's
now
fine.
While Dr. Oler is talking and throughout this entire presentation, we can take your live questions on Facebook and YouTube. So while you're watching, hit us up with questions. And at the end, we'll have a little Q&A in order to answer the questions that you might have. And I have a feeling if you watched last month's Evergreen Talks, there's usually a sense of humor involved, and definitely we can go just about anywhere you want. This is a very frank discussion, and it should be, and that's why these are so effective. And that's why we invite you to join us the second Thursday of every month at 4 o'clock for Evergreen Talks. Okay, Dr. Oler, enough of me. Let's hear from you. Demystifying birth control. Thank you for being here today.
Thank you for having me. So of all of the talks, this is probably the one that is the most frank and potentially the most uncomfortable. It's kind of funny to be doing this without a live audience. Some good, some bad in that. The good that maybe it's better. I don't see a lot of people's faces as I discuss these topics, but sometimes it's kind of nice to see your faces. So I will miss that a little bit, but I'll have some fun information on the birth control options that we have available. There are many, and it is overwhelming, frankly, for a lot of women. And it is one of my favorite topics because of that. So for that reason, that it requires a lot of choice and a lot of thought and a lot of counseling, and it's not necessarily a automatic finding the right option for me because it's clear. And so it's one of the things that I spend the most time talking to my patients about. So we are going to talk about a lot of the different options. Pretty much we're covering, at least to some degree, every option that is out there for birth control, even the ones you wouldn't think of. And we'll go into some detail about each individual one. But ultimately, the goal of this conversation is to help you have a baseline to come in to visit with a provider so that you can get the right prescription birth control for you. All of these, most of these options that are effective and that you're going to want to use will require a prescription. A lot of them don't, and so that's some of the benefits of those options. But it is a good thing to really talk to a doctor about because there are a lot of personal decisions being made in this process, as I hope I will make clear. So go ahead, Brian, to the next slide. So where on earth do we start? So this is a really important question because when you're approaching a conversation about something like birth control where you have so many options, you want to really narrow it down by asking yourself some key questions. And remember, these answers are going to be different for every person. So the first question is, what do you want from your birth control? That sounds like an easy question, but it's actually not necessarily an easy answer. You're going to want to think about things like, do I want the method that is going to have the most efficacy at preventing pregnancy? So if I get pregnant tomorrow, would that be the most devastating thing that has ever happened to me? Or it'll be a lot of birth control, as you probably know, also helps with other symptoms that women experience surrounding their periods and their cycles and fertility. And so there are many questions people have about, well, what is going to control my period the best? Or I have these specific PMS symptoms. What do you think is going to be the best method for that? And then if you don't really care as much about getting pregnant, but you want something that's easy to take or easy to stop taking if you want to get pregnant at some point in the near future, those are other questions to be asking yourself. And we'll go into detail with those questions with each individual method. So what are your priorities is the next question. What symptoms do you have? So yeah, if you're having severe period-related symptoms, birth control can actually be a great option for you, regardless of its ability to prevent pregnancy. And a lot of times women even come to me saying, I want to control my periods, but I also want to get pregnant. And that can be a little bit difficult because, believe it or not, many of the things that we do to help with women's periods also unfortunately prevent pregnancy at the same time. So asking yourself the symptoms that you have, but also thinking about what might be an option for you that helps those symptoms while also preventing pregnancy. All right, next question would be, what are your specific underlying health issues, family history? So things that you should be thinking about are migraine headaches, blood clots, especially in your legs or lungs. Those are some potential medical history things that could affect your eligibility for birth control. So not all birth control is available to every patient. There are some contraindications. And so it's very important, super important, that when you first come to your doctor, you have a thorough history and physical exam to go through all of the history that you have personally so that we can make sure we're not going to cause harm by any of the methods that we're giving you. Next question would be, what side effects are you willing to tolerate? That's a really good question because all of the birth control methods have side effects. Now, this is one of the biggest takeaways of this is I do not have a magic bullet. I do not have the perfect solution. I don't have something that is going to be 100% side effect free, symptom free. So again, going back to the beginning here, what are your priorities? What are you willing to give to take, right? So there's a little bit of give and take and push and pull in tolerating some side effects for the priorities that you have. And so that's really important to remember when you're approaching this conversation. Really any conversation that you're having with your doctors, because that is just the reality of a lot of the medicines that we have for all conditions. All right, next slide. So here is a kind of broad picture overview of all of the methods that we have available, some of them being kind of tongue-in-cheek here. So for example, the padlock being not right now, we're just gonna not have sex, which is, I mean, of all of the birth control methods, the best option. So abstinence is truly the only guaranteed foolproof birth control method, and that is not realistic for most people. So what we want is something that will work for us, but that also works in our lifestyle so that we can choose when we want to get pregnant. And then some of these other pictures here represent, I'll show pictures of all of the birth control methods, but in the top right corner, one that I don't have in slides individually because that is a slightly different conversation, is if you don't want kids at all, or you are done having kids and you've had kids before, that top right corner is the tube tying or sterilization. And that's a different kind of, well, we won't go too much into detail on that one because if you're really done having kids, that's a conversation you have to have with your doctor. All right, next slide. So we're going to break down the methods into kind of categories to bunch them together and make it a little bit easier to make buckets in your head about what to think about first when you're thinking about birth control. So two big buckets here are going to be the hormonal methods in one bucket and the non-hormonal methods in the other. And then there are some offshoots from those two bigger buckets. So next slide. Hormonal methods. So they include many different things. So we're going to start with the combined estrogen and progesterone methods. So next slide, that would be the pill, the ring, and the patch are the three big combined birth control methods. And again, so the ring and the patch are pretty much the, one individual thing. The pill has many different forms. So that is the one that we're going to go into a little bit of detail on. Next slide. And then progesterone only methods. So like the last category was estrogen and progesterone together. And we'll go into a little bit of detail about that, like I said, and we're talking about the pill. Progesterone only methods have only progesterone and no estrogen in them. And that has some benefits for certain medical conditions and also for people who have certain side effects with their birth control. So these methods include, next slide, the PROGESTIN IUD, the birth control shot, or Depo-Provera, or just Depo, as most people fondly call it, and emergency contraception. So that is, of course, one that we'll go through as well. That is not necessarily, I mean, I put it in here as a birth control method. It's not really something that we want you to be doing frequently, but it is absolutely there for emergencies. All right, next slide. So next, we're going to go through the non-hormonal methods briefly. And again, I'm going to go through all of these individually in detail, but this is just so you can kind of get the pre-overview. These include the copper IUD, condoms, spermicide, the diaphragm, the cap or cervical cap, the cervical sponge, Phexxi, which is a new, actually quite new non-hormonal gel. It's prescription only. It's a little expensive, but it is a new option. Fertility awareness, and the pull-out method, which I just have to talk about because it is a method of birth control, believe it or not one that we generally recommend as first line, but it is the only option available to some people. So we can go through that too. All right, next slide. So we're going to go through kind of individually, one by one, each of the methods, their pros, their cons, positives, negatives, and we'll go into some detail. Again, this is really a conversation once you've kind of thought about it a little bit more to have with your doctor once you've kind of narrowed down what you think is best for you. So the pill is probably the most common method that we prescribe. It's the easiest, so it's the most readily available of the birth controls. It's the cheapest. It's easy to start and easy to stop, but the drawback of being easy to stop is it's also easy to forget because you have to remember to take the pill at about the same time every day. And if you forget to take it, I can't tell you how many people come in saying, I was on the pill and I got pregnant, because it has a lot of user error. And so that is one of the big drawbacks of the pill. So some pros of the pill, and this is the estrogen progesterone combined pill. There's also progesterone only pill that we'll go through shortly. Pros of the pill are a little bit more control over your bleeding. Now that is a bit of a double-edged sword because if you try to skip your period week, you might have some irregular spotting that's a little bit unpredictable. But if you're like, I'm going on vacation and I want to go to Hawaii and wear a bathing suit and not be on my period, and your period week, which is the 4th week of your pills when you're on the sugar pills, if the 4th week is during that time, you can actually just start your next pack a week early and kind of skip the period for that month. And so that can be kind of nice. That's one aspect of the pill that's nice. Another aspect of the pill that's nice is that it has some flexibility with dosing. So there are 2 broad types of birth control pills. There are cyclic, and so tricyclic and monophasic. So this tricyclic birth control options, or the birth control pills, have different doses of the hormones throughout the cycle, throughout your month, to kind of try to mimic the natural cycle. Now, honestly, a lot of women go on to birth control because they want to control those cycles. They don't want to have the ups and the downs and the swings. And one really great thing about the birth control pill is that it's probably the most effective method at controlling cycle-related symptoms. So things like PMS and cramping, and of course your periods are going to be a lot lighter. So although you will bleed every month, you'll have a lot lighter bleeding than you do without the pill. And then the other thing is there are different doses even within the monophasic pills. So when you're taking the same dose of the estrogen and progesterone throughout the month rather than that up and down dosing, if you're on the same dose, there are 3 different levels of estrogen dosing, and that provides a bit of flexibility. So if you feel like, oh, I'm having some side effects with this one, we can go down or up on the dosing. There is a 4th level, very, very low dose. We generally only do that if it's the only option for side effects, but it is also, there's a 4th lower dose estrogen option. But those tend to have a little bit more side effects with bleeding. So again, things to talk to your doctor about kind of when you want to tailor your birth control to your needs. Then finally, there is the 3-month Seasonique birth control pill that is a 3-month phase of taking the hormonal pills and then 1 week of taking the sugar pills. So rather than having a period every month, you have a period every 3 months. This is really nice for women who are like, I just want to have a period every 3 months, which is great. The only drawback of that is that sometimes there's more increased spotting in between your cycles. So you'll have a little bit more irregular bleeding with those types of birth control. But for some women, they're willing to accept the spotting because they really just want to have the period once every 3 months. And in some cases, so if there are severe period bleeding related symptoms, so for example, women who have menstrual migraines, where when they're on their period, they develop severe migraine headaches. That is generally because of, and this is something to talk to your neurologist about as well, but that is sometimes because of the loss of hormones. So you have a week without the hormones. You can actually take birth control continuously, meaning you never skip a week at all. And you always take the hormonal pills. Now, again, the drawback of that is really breakthrough spotting for most people, but it is a great kind of flexibility that we have with the pill that we don't have with other methods necessarily. So that's kind of the broad overview of the combined birth control pill. Now, some of the drawbacks of the pill, as I've already said, the effectiveness. So it's not quite the most effective method, especially if you're not good at taking a pill every day. And then another thing is that estrogen is contraindicated, and this will apply to the next 2 options as well. Estrogen is contraindicated in certain medical conditions. There is a long list of them. Most people who are coming to see me in the office don't have any. So don't worry, you're most likely eligible for estrogen. These are rare conditions, but if you have a significant health history, it's very important that you talk to your doctor before starting an estrogen-containing birth control method. All right, next slide. The patch. So this is also a combined hormonal method, so both estrogen and progesterone. The patch is a nice alternative to the pill. If you want to do a combined estrogen progesterone, you want to have a period every month. Similarly, you take the patch off for a week. This is a weekly method, so you change the patch once a week. Honestly, you wouldn't want to leave it on for longer than that because it often starts to peel off. But unless you have a very intensive bathing regimen or you're going in the pool every day, the patch really doesn't fall off for most people. So the next slide. This is a picture of the patch. It looks big, but honestly, it blends into the skin pretty nicely. And it generally, so the places that we recommend you put it are pretty hidden. So next slide, you'll see the different options for where you can place it. I generally tell people don't do the exact same spot every month. So, and it can even be as simple as, okay, I put it on one butt cheek 1 month and the other butt cheek the next month, and that's fine. And hopefully no one's seeing that anytime. So you're pretty much covered. You can't see the patch and it's well covered by clothing, even bathing suits. Okay, next. So one more thing to say about the patch, like I said, it's a weekly method. So you do have to remember, I usually recommend setting an alarm on your phone or something like that. Every Monday or every whatever day you choose, you're going to switch your patch. Now the kind of user error involved in that, it's a little more flexible. So it doesn't have to be the exact same time every week. But yeah, of course, if you miss it by a day or you take off, the patch falls off early, you could potentially lose some efficacy there. The ring is the next method, so also with both estrogen and progesterone. This is one of those love it or hate it cult favorite birth controls. People who love the ring do not want anything else. This is like they're done, they're sold, it's easy for them, they like the way that it works for them. There are a few things to get over with the ring. So it is vaginal. So you have to be prepared to place the ring vaginally. It has to be stored in a refrigerator. So if you live in a room or in a house with a lot of roommates, that might be a little bit uncomfortable, but it's super easy. And this is only once a month. So you do have to set an alarm on your phone to put it in, to take it out, and then to put the new one in, because of course you're going to have a week off with the ring as well to have a period. The ring can be taken out to have sex and put back in, but it can also just be left in, and most partners don't feel it. So next slide. That's the ring. It looks big, but believe it or not, the vagina fits quite a bit. So, you know, you can fit a baby out of there eventually. So the ring, it sort of finds its way to the right spot. And again, for some people, it's super uncomfortable, but for others, it just settles right in and they barely notice that it's there. Okay, next slide. So this is a little picture, a schematic of where the ring will go. So the finger is kind of in the vagina. You can see the bladder right there that's above the ring. And then the cervix is a little bit higher up there. So you can see the cervix and then the uterus kind of on top of the picture there above the bladder. So the ring, you kind of push it up all the way as high as it will go into the vagina. And then when you want to pull it out, you just put your finger in and you kind of hook it around and just pull it right out. Okay, next. Now we're going to move on to progesterone-only birth control methods. So first is going to be the progesterone-only pill. So the progesterone-only pill, I didn't give a picture because it's not much different from the estrogen-containing one, except that most progesterone-only pills are going to be taken all throughout the month. So you don't have a week off. The reason for this is that the progesterone-only pill is a little bit less effective than the estrogen pill and has a little bit more potential for user error. So you really have to take this one at exactly the same time every day if you're using it for birth control. And if you miss even by an hour, that really decreases the efficacy of this method. So it's not generally a first choice, but for women who really want a pill, really motivated to take a pill, and they can't have estrogen, this might be one of their only options. This is also used a lot in breastfeeding because women who are breastfeeding don't want to take estrogen before about 8 weeks because it establishes it can kind of interfere with milk supply in the beginning of breastfeeding. And so we can use the progesterone-only pill for women who wanted to then transition later back to the estrogen-containing birth control method. So like I said, it's same dose of the progesterone every day for a month. There is a little bit of breakthrough spotting with this method. So that is one thing that can be kind of a drawback. But for people who really want a pill and who really want to be able to stop at any time, or if they can't take estrogen and they're not willing to try some of the other methods, or even later in life, a lot of women come to me and they don't necessarily need these for birth control purposes. They want it for other medical reasons like bleeding control. The progesterone-only pill can be a really good and a little bit safer option relative to the estrogen-containing methods. Okay, next. Next is the IUD. This is a lot of gynecologists' favorite method. So the reason being, and we joke in our profession a little bit about the fact that we sometimes push this a little too hard on patients. And we've actually had a bunch of studies on, you know, the bias of the provider in explaining options for birth control, because there have been concerns in the past that we try a little too hard to push patients to choose one method or the other. But there are reasons why the IUD is the fan favorite for gynecologists for several reasons. So the IUD, of course, the biggest thing that you have to get past is putting something into your uterus. It is uncomfortable, it hurts, and it is definitely a little bit hard for people to kind of wrap their head around. And of course, I cannot tell you how many women come to me and tell me the horror stories they've heard about the IUD migrating, or it perforated and someone had to have it removed surgically and it went into their bowels and their intestines. Those are like 1 in 1,000, 1 in a million events. I personally have never had that happen. I've always been able to remove IUDs that I've placed. I have occasionally done from other providers. That's not to say that, you know, it happens, right? And I'm sure at some point in my career, I'm young, it will happen to me too. But that's to say only, not that I am better than anyone else, but that truly it is so rare that I still have yet to have that kind of complication. So the Progestin IUD is great because it is so easy. Once it's in the uterus, it stays there. It stays put. Now, of course, rarely it will expel early. If you have a really heavy period, some people have had it expel after having a baby. Sometimes if you have it placed soon after birth, it can expel a little bit easier, but that is so, so rare. And I've actually had patients have a second one placed after they had one expel accidentally, and they did fine. So just because it's happened once doesn't mean it will happen again. But the thing about the IUD is once you get past it and try it, this is probably the one that has the least amount of side effects and is the most well tolerated by most women, because you don't have to think about it. All of the other methods we've gone through so far, you have to remember, set alarms in your phone. You have to be on top of it. You have to make sure you don't miss it. You have to make sure it's not late. This is really just there, and you forget about it, and it's effective. It is so versus the pill, which is around probably 93% effective with normal use, maybe even a little bit lower. The IUD is 99.999. Now, of course, that is not 100. Nothing is 100% except for abstinence, as I said. So I can never guarantee that you won't get pregnant, but this is about as close as it comes with a reversible method, meaning you can easily remove this. Now, you do have to go to a doctor, and that is one of the drawbacks, that you have to come to the doctor to have it removed. But when you remove it, you can get pregnant very easily. And that leads me to another point about the progestin IUD, and that is that of all of the hormonal methods, and there are actually multiple levels of dosing for the progesterone in the IUDs, the IUD has the least amount of hormones of any of the methods that we have available. And what that means is that for the women who really have issues with hormones, but they still want to stop their periods, this is the best option, because most people, once the IUD is placed, don't have any bleeding at all. And if they do, it's a very, very light spotting. Like you don't even have to wear a panty liner most of the time. And that varies. Some people do, and especially, and this is something I always tell everyone, in the first few months, you have to just stick it out, because in the first few months, most people will have a little bit of irregular spotting, cramping, kind of feeling their uterus a little bit more than they're used to. But that does go away for the vast majority of women after some time. And so those are some of the pros. It's really effective. It works by actually, so the progesterone in the IUD is what causes it to work. And it kind of thickens the cervical mucus, so it makes it harder for sperm to get in. And it thins the lining of the uterus, which is why it's so effective for stopping bleeding. Now, the other side of that coin, so meaning the kind of low hormone version, is that for most women, it does not actually interfere. It doesn't stop your ovarian cycles, your ovulation cycles. And so what that means is that most women still have a little bit of a cycle. They may still get a little bit of PMS. They may still have they feel a little twinge when they ovulate. So the thing about that is that because the dose is so low, it just doesn't get into the bloodstream very much. And that's not how it functions. Most hormonal birth controls actually suppress your ovulation. So like I was talking about with the pill, that can actually be a benefit if you really want to suppress your cycle related symptoms. Whereas the progesterone IUD, it doesn't reliably suppress the ovulation. And then the flip side of that is that there is a slightly higher risk of developing ovarian cysts with the IUD, larger ovarian cysts. And so whenever someone has an IUD, they come in with pelvic pain of some kind. I always recommend an ultrasound, because sometimes we do find a slightly larger cyst, and those cysts can burst, and burst ovarian cysts are terrible. And if you've ever had one, you probably don't want to get an IUD, but doesn't mean it's off the table, but you should talk to your doctor about it. All right, next slide. We'll have some pictures here. So this is Mirena, which is one of the three main options we have. Mirena, Kyleena, and Skyla are the three sort of major. There's also Liletta. So those are the different hormonal IUDs available. Some have lower doses. I tend to shy away from the lower dose options because they have more bleeding side effects, but there are a couple that are smaller. So if you haven't had a baby before and you really want an IUD, you can get a smaller one that's slightly less painful to be placed, but it's painful no matter what. So usually I recommend the Mirena. And so the Mirena goes in the uterine cavity here. You can see this is honestly about it depends I guess on your computer size, but the uterus is very tiny. So a lot of people are surprised by that. It's about the size of a pear. An upside down pear would be kind of a analogous size. And so the IUD is very small. It just kind of wedges itself and kind of sandwiches itself into the cavity there with the arms outstretched, and the strings come through the cervix, and we can see them on exam, so we know your IUD is still there, and then we trim them at the end of the procedure to have it placed. And the procedure to be placed, it's very uncomfortable. Like, don't get me wrong, it's not fun, but for some women, it's like, it's That, and then for the Mirena, it's now 7 years of birth control protection. The FDA just approved it a couple weeks ago for 7 years. So that's a short amount of pain for a lot of gain for many women. Okay, so next slide. The shot. So the shot is kind of on the other end of the spectrum, probably the least favorite of the gynecologists for a few reasons we'll talk about. But it is, if it is the one that works for you, that is fine. Again, this is a personal decision. I say this mostly jokingly because really, truly, this is your decision to make, not ours. But the shot is a great method for women who want reminders to come into the office, because we will harass you. We will say, hey, you need your depot. And they don't mind getting a shot in the butt every 3 months, because it is about every 12 weeks that you have to get it. And if you miss it, you can get pregnant very easily. You can have breakthrough ovulation. So the shot works by suppressing ovulation. So this is another one. The hormone level is very high in the shot. It's actually the highest of the progesterone methods. And that has some drawbacks for side effects and for longer term use. So most importantly, bone density loss. So if you use the shot for a long period of time, you actually, especially more than 5 years, you can lose some bone density. It's thought to be reversible, so it's not something that's permanent, but it's still, we can continue it if it's really what you like, but we kind of want you to consider putting an expiration date on that. And then the other thing about the shot is that it is the one most likely to cause weight gain. So everyone always asks that question. The majority of birth control methods do not have weight gain as a common side effect. Some do. I mean, some people do. Everyone responds differently to different medications. I can't guarantee you that you're going to have one side effect or another. But with the depot, it's almost universal that everyone will gain a little bit of weight. Next slide. So there it is. The medroxyprogesterone acetate is Depo-Provera. 150 milligrams is the dose, and it's a shot in the butt every 3 months. Next slide. Finally, in the progesterone-only methods is emergency contraception. So there actually are a few different types of emergency contraception. The most common that we use is Plan B. It's one step, so it's a single pill. Next slide. And so if you go to the next slide, it'll show the picture there. Oh yeah, that's actually, I thought for a second, I was like, I put that in because I just thought it was kind of funny. But there is a Plan B, one step is the most common prescribed option. And it's just a single pill. It is not really a birth control method as much as it is truly an emergency method. So you're using another kind of birth control, something fails, you're worried, you take this method. This has a lot of side effects too, because it's a very high dose of progesterone. A lot of GI side effects, kind of stomach upset. It will interfere with your cycles. So you probably will have an irregular period, or you'll skip a period, or you'll be late, which of course is a little scary for when you're worried about being pregnant. So just have pregnancy tests ready. And it is not a guaranteed method. It's not 100%. And you really do have to take it within 72 hours of the event. And that's a big barrier to people who haven't been to their doctor in a while, or who can't get a prescription for it. So, of course, it is a prescription medication. So that's one drawback. But if you come to your doctor and you say, I just want to have it, I just want to have it as backup, we can prescribe it with refills so that you have it available for you when you need it. Okay, next slide. Next, we'll transition to the non-hormonal methods. I'll go through these a little bit quicker because they're a little bit less common and less popular, but there are a lot of them out there. So the copper IUD, similar to the progesterone IUD except no hormones. The way this works is that copper is actually very toxic to sperm, and the nice thing about it, similar to the progesterone IUD, is that it's very localized. So you're not going to get any systemic real side effects from the copper. Same thing goes for the progesterone. It really stays in the uterus. The copper IUD does not interfere with your cycles and is completely hormone-free. So this is the best method for someone who comes to me and says, I cannot tolerate hormones in any form. I need a hormone-free birth control, but if I get pregnant tomorrow, I will die. So this is the best one for those people because it doesn't have hormones. It is extremely effective, 99.999%. Nothing's perfect, but it is very effective, similarly to the progesterone IUD. Next slide. And I think, yeah, there's a little picture of it. Same exact size as the Mirena IUD, very similar procedure to have it placed. Next, the male condom. So this one, of course, is probably the most well-known popular method of birth control. that you don't go to the doctor for. These are widely available, including in our office. So please come and ask. We have free condoms. We can give you a whole bag of them. We have multiple different types, flavors, colors, you name it. So male condoms come in all shapes and sizes. Next slide. And so they are, of course, I mean, these kind of are self-explanatory. It goes without saying. You know that you are supposed to put it on before you start having any penetration, because there can be pre-ejaculate that has sperm in it. And you have to keep the condom on and make sure that it is fully intact when it comes off. Okay. Partners who use condoms, honestly, sometimes this is the best method for them. There can be, of course, a lot of user error in this as well, which is why the condoms aren't as effective as some of the other methods, really in the 80%, which means, you know, maybe up to 15% of the time you could get pregnant with this. So I have a lot of patients that come in because of condoms breaking, or they just, you know, forgot one time, either to get emergency contraception or for pregnancy. So the nice thing about condoms is that there are a lot of options, and some people actually find them pleasurable in some ways. There are like the heated ones, and there are some, you know, ones that have special lubricant with them, and textured. So there are different ways to play around with this, and I will leave that to you to kind of explore. I don't have any specific recommendations, but it is definitely more of a trial and error kind of thing. Next. The female condom, this is one that's very, very uncommon, very rare to find people asking for this one, but it does exist. Next slide. It's pretty intense looking. So the top part goes up at your cervix, and it's like the contraceptive ring. So it actually is a kind of a ring that holds it in place. Again, similar to the male condom, this is a barrier method. So this does have user error involved in preventing pregnancy. Now that we're kind of transitioning out of condoms, I have to say this. Condoms are the only method that is proven to prevent the transmission of sexually transmitted infections. So I just always say this at the end of every visit for birth control. I can give you all of these things to help you prevent pregnancy, but I cannot give you I can't prescribe anything to prevent STIs. So you do have to use a condom, especially with new partners, especially if you're not sure about your partner. And so it is this, both the female and the male condom are proven to prevent sexually transmitted infections. Nothing is perfect. You can still get STIs even when you are using condoms, but that rate and risk is a lot lower. Next. The diaphragm. So this is another barrier method. Next slide. You can see how it looks. It kind of similar to the ring, goes all the way at the top of the vagina under the cervix. It has a little knob. You can actually come into our office and be fitted for a diaphragm, so we can find the best size for you. We do give samples, so we use samples in the office. They have a hole in them, so do not take the diaphragm sample home thinking that you can use it for pregnancy. You do still have to get the prescription for the diaphragm and fill it at your pharmacy, but insurance will cover. And this goes also for all the other methods. Insurance covers all of these methods. So that's the diaphragm briefly. Next. Cervical cap, another barrier method. So this is kind of funny looking. It's a little more rigid. So if you have a little bit of weirdness with kind of trying to wiggle things up there, this is like you just kind of push it up there and eventually you'll feel resistance and it stops moving, and that's when it's around the cervix. Again, not 100%, and male can kind of sometimes feel this a little bit more. So this is maybe a less preferred option, but it is something. The nice thing about the cervical cap and the diaphragm too is that you can put spermicide inside of the cap. So inside the part of it that is indented, you can actually put spermicide to add to the effectiveness of the method. So next. And the sponge actually is impregnated with spermicide. It has spermicide in it. Next slide. So it looks like a little donut, and it goes, so you can see the picture there, kind of under your cervix at the top of the vagina. It fits snugly, and sometimes partners kind of like this method because they can feel a little bit more resistance. You may have less symptoms with deeper penetration because it can be a little bit of a bouncier, not direct hit against your cervix, and some women have a lot of pain with sex with their when men hit their cervix. So so that is a nice benefit of the sponge, and it has, like I said, spermicide in it, and so that is something that some people really like for ease of use. But remember, for all of these methods, you have to put it in, and you have to have it there, and you have to be ready for it before you have sex. And so that is a huge kind of drawback to these methods, because a lot of times you're not necessarily thinking about doing all of this stuff before you start. So that's the sponge. Next. Phexxi. So this is a newer medication. It's a vaginal pH agent. So it changes the acidity of the vagina to be unfavorable for sperm. So it's kind of like a spermicide, and it can be helpful. I haven't really prescribed this to a lot of people. The effectiveness is about the same as spermicide, which is pretty low, and we'll go through that next. But it can be a nice kind of method that doesn't, if people are really sensitive to spermicide and want something else to use besides spermicide, that can help with preventing pregnancy in addition to some of the barrier methods. So you can use this with a condom, with a sponge, with a cap. So, and a diaphragm, and that's the applicator. If you're interested in this, like I said, it's prescription only. You do need to come to your doctor. We can put in a prescription for it. Again, you have to put it in before you have sex. It does not work after. So it really does need to be placed, and you have to be really reliable with it in order for it to be effective. Next. Spermicide. So this is, as it sounds, next slide. There are a few different kinds of spermicide. So there are gels, there are foams, there are capsules, there's, I mean, you name it, there's all kinds of stuff. They're all over the counter, so you can choose which one you like. Some of them even are kind of like lubricating, but you have to make sure to follow the package instructions to a T, because again, all of this is user error. There is potential for messing it up. And I do generally recommend using spermicide in conjunction with all of the barrier methods as an additional added kind of assistant, because if you really don't want to get pregnant, remember, none of the barrier methods are super effective. So this just gives you a little bit of a boost. Next. And the withdrawal method. I don't have a picture for this one for obvious reasons, but you guys all know what it is, the pull-out method, the withdrawal method. I mean, hey, it is the oldest in the book in terms of birth control methods. It is very unreliable. So about 20% of the time it will fail. So that's a really high percentage. And it can be used in conjunction with the next one we're going to talk about, which is we're going to go through very briefly because it's got the natural family planning and fertility awareness. But certainly if you're closer to your fertility window, definitely at least use the pull-out method. But again, pre-ejaculate has sperm in it. It is not very effective, the pull-out method, unfortunately. And you have to have a very, very much in control partner, because you are relying on him to do all of the work for you. And that can be a little bit, you know, as we all know, relying on men to do things is not always the best way to go. Natural family planning or fertility awareness. So this is a very complex method that really I would encourage you, if you're interested in doing this method, go online, look at resources. There are a lot of resources out there on this, and you really have to find the way that works best for you. Next slide. I thought I had a couple pictures in here. So there's a temperature, basal body temperature method, where you literally have to take your temperature every single day before you even get out of bed. So like at your bedside, before you even move, you want to take your temperature, the first temperature of the morning. And that requires a lot of effort. And then you also can check your cervical mucus. So you can actually stick your fingers up there and check based on a little calendar. And there are some kind of resources out there for how to check the cervical mucus and interpret it. And then also just calendar method, tracking your cycles, knowing when your fertility window is. This is also, unfortunately, not a super reliable form of birth control. And you really, if you're going to use the basal body temperature and the cervical mucus method, you really have to be on top of it and really paying attention to your body. This can be actually super helpful. And I do a lot of counseling on this for women who are trying to get pregnant, because I can tell you with these methods, when you're most likely to have have ovulation and to be able to get pregnant. So this can be kind of a nice way to learn your body and to get in tune with your cycles and to know when you're ovulating, because that really is an important, I think, very important to know your own body very well. And when you're not on birth control, of course, because when you are on most birth control methods, you're going to be suppressing that natural ovulation cycle. But once you come off birth control and you're starting to think about having a baby, or if you really are motivated to try this method for birth control, I would recommend coming to your doctor to talk more about this option. So, and now I think that's it. Any questions?
All right. Well, Dr. Oler, like we said, and what I promised, there was some levity through that whole entire presentation. Thank you for all of that.
Sure.
I'm going to, let's see, we'll stop that. There we go. All right. Well, as far as questions go, how about this one? What would be the best method for controlling my period?
So good question. So we did it. There was a lot of kind of back and forth about this, and it can be kind of hard to choose the best method for controlling your period. And remember, it is all about what you want. So there are methods that stop your bleeding altogether. So actually the depot is the most likely method to stop bleeding completely. However, there is also breakthrough bleeding with depot. So that's not 100% reliable, but a lot of women do experience no bleeding at all when they've been on depot for some time. The IUD, the progesterone IUD, that does also control most women's periods because, like I explained, it thins out the lining of your uterus. So there's just nothing there to really bleed. And so that is a really good method for controlling your period. But the drawback of that is that you're going to be on whatever cycle your body has. So you're going to either ovulation or it'll just be kind of random spotting. If you want to know exactly when you're going to bleed each month and you don't mind bleeding, then the pill or the patch or the ring or any of the combined birth control methods, estrogen, progesterone, are really the easiest because if you take it the way you're supposed to, most people will only have bleeding during that week of their period. Now that's, of course, there's exceptions to every rule. And again, these are reasons to follow up with your doctor after starting a method to make sure that it's working for you. Because remember, even if you're on the pill, there are other options. There are other hormonal options, the other types of birth control pills that you can try different doses, and you can see if progesterone only is better for you, or if you want to try the slightly higher dose of estrogen, or you want to try the triphasic. You want to see if it works better for you to have the differing levels of hormones throughout the month. So generally, as long as you're willing to work on it, the pill is probably the best method for controlling your period and predicting exactly when you're going to bleed.
Okay. All right. Another question. Can you explain a little bit more about the different kinds of combined estrogen progesterone pills?
Yes. So we talked a little bit about the 3 different doses. I think I went into pretty good detail about the triphasic versus the monophasic. But for the estrogen progesterone pills that have different dosing, so there's low dose. So low estrin is the brand name of that one. There aren't as many women on that one, but if you really want the lowest dose of the estrogen because of side effects from estrogen, but you really want a combined method, that is a good option. It has, I believe it's 0.15 milligrams of estrogen. And then 0.2, 0.25, and 0.35 are the, or sorry, 0.2, 0.3, and 0.35 are the other doses of the single monophasic estrogen progesterone combined pills. And those, so there are so many different birth control pills out there. And this is another thing, I'm glad you asked this because I've almost forgot to mention this. When I prescribe birth control, I'll say, I'm putting in a prescription for something called Lutera, but you're probably not going to get Lutera. And that's okay because there are hundreds of different brands out there that are making the exact same combination of hormones. And so occasionally I'll have women come back to me and say, I just, this month it worked and then I got a different one and it just didn't feel quite right. So we can work with your pharmacy to get you the right one. Even though they should be the same, they're not always exactly the same. But again, so it's that 3 different doses. The low dose is the most common that I use, not the low, but the low dose estrogen. So that's 0.2 and 0.2 milligrams or 20 micrograms daily. And that is really good for kind of a starter to see how it goes. It's least likely to give you estrogen related side effects. The middle dose, so that's usually a pre is the one that I prescribe. Again, it's going to be something else, but that's one of them. And that has 0.3 milligrams of estrogen. And that one is good for women who, especially if you have like endometriosis or PCOS and you have more estrogen or more hormonal imbalance issues, that can be a little bit better for some of those women. There are some variations in the progesterones that are put into the pills, and that's also a very different conversation to have about specific issues. So again, if you're coming to talk to me about birth control because you have PCOS or you have acne or you have some other reason for birth control, endometriosis, all of these things, there are some subtle differences that we can discuss in the different formulations of estrogen and progesterone. So hope that answers that question.
All right. And the last question that we have here as we wrap up, I really hate hormones and have had side effects from them before. What would you recommend?
So good question. I get this all the time. So a lot of patients have either been on the pill before or the shot, and they just had a terrible experience. That does not mean that you're signed up for the rest of your life to not have any hormones at all. So like I said, some of these methods do have benefits and still have low side effects. And I'm realizing now that I forgot the implant in your arm, the Nexplanon. But that is another one of the progesterone only methods. And that is the bar that goes in your arm. That's a pretty popular one for 3 years. And that's a kind of medium dose of the progesterone relative to the depot and the IUD. But again, you know, it's something to talk to your doctor about. It has a few more bleeding side effects. And so again, this is more of a personal conversation to have with your doctor, because you may still find that something like the Mirena or Skyla IUD that has a really low dose of the progesterone might still be good for you. But if you really don't want to have a baby and you're really you cannot tolerate the hormones, I usually point women toward the copper IUD, with the caveat that most people do experience slightly heavier bleeding. So heavier cycles and more cramping with their cycles with the copper IUD, but that doesn't mean necessarily that it's off the table. So,
okay. Well, thank you for all of that, and thank you for everybody who watched today, Dr. Oler. We appreciate all your information, and maybe we will see you again one day soon. You can join us on the second day, Thursday of every month at 4 o'clock for Evergreen Talks, right here on the Evergreen YouTube and Facebook channels. And of course, you can visit evergreenfamilymedicine.com for more information, and visit Evergreen Women's Health, which is on the evergreenfamilymedicine.com page for blogs and other information that come from the amazing team at Evergreen Women's Health. Well, Dr. Oler, I wish you a good afternoon and a good weekend upcoming.
Thanks, Brian. I appreciate you having me here today.
All right.
And hope this was helpful for you guys.
What's that?
I hope it was helpful for you guys out there and in the audience.
I'm sure it was. Yes, thank you. It's helpful for me too. I was paying attention. I was tracking.
Oh, good. Learned something, I'm sure.
Have a great day.
All right. Take care, guys.